you know. Hello, my dear friends. A very warm welcome to all of you in this session where we are going to discuss the expected question for NEET exams. We will also discuss the high yield topics which for your upcoming exam. And if you have any doubt, any question regarding any previous year exam or any questions you have, please ask it in the group. So let's start this discussion with one question, that what is the difference between recommended dietary allowance and estimated average requirement. This EAR which I have written here stand for estimated average requirement. Okay, the difference is that this estimated average requirement is the dietary intake for 50% of population, and recommended dietary allowance, this is the dietary intake which is needed for 97.5% of general average healthy population. So RDA is always more than estimated average requirement. Okay, average requirement which fulfill 50% need, RDA which fulfill the dietary need of almost all the healthy population, 97.5% population. Okay, of course we will also discuss the treatment and guidelines of leprosy and HIV programs, and I would like to discuss also in last of the session we will discuss how to work on this decreasing exam anxiety and how to increase our efficiency during that 3 hour, because all of you must have felt that in any exam almost 30 to 40% question can be solved based on your presence of mind. Just by ruling out 3 options you can improve your score by 20-30% if on that day you are relaxed and less anxious. So we will discuss these 2 things also. But before that, let's go through some of the questions which I expect that they are from the important topics and similar questions can come. One is that they are saying in this question that doctor is using highly sensitive test on a patient and result is coming positive. So what does this mean? I expect all of my friend to answer whatever comes to your mind, and there is no wrong answer in the class, of course, so you can answer anything. So if the test is highly sensitive means it will include as many people as positive. So that means true positive will also be high and false positive will also be high. Please remember that false positive and true positives both are directly proportional to sensitivity. If a test become more sensitive, then chance of false positive is also high, and we will get false positive if prevalence is low. We will get false positive because in the population less people have the disease. So if sensitivity is high, we will get high false positive. But if prevalence is high, then the result which we are getting is probably true positive. For example, when corona started in India in April-May 2020, at that time if you look at the result of RT-PCR, so at that time the prevalence of corona was low. So at that time false positive will be high. Okay, this is known as Bayes theorem, and Bayes theorem says this point that if disease rare, then false positive will be high. Okay, and disease rare means prevalence is low. So let's look at the option. Option 1 is saying if it is a rare disease, then this can be considered positive. No, if it is a rare disease, then this can be considered as false positive, not true positive. So option 1 is not right. Option B, highly likely that patient has the disease. No. If test is sensitive, it does not mean that patient have disease only. It can be true positive or it can be false alarm, false positive also. So this is also wrong. Now look at option C, highly unlikely that patient have disease. We cannot say that. It all depends how much is the prevalence, how many people have the disease. So last option, if you see, they are saying if prevalence is high, then patient has the disease. Patient has disease means true positive. So remember, prevalence high, chance of true positive high. If disease is rare, that means prevalence is low, then false positive will be high. Okay. So this is one question. I hope it is clear to you. Very good. D is the answer. Most of you have given the correct answer. Chetan, Vikram, Dhanasai, Himabindu, Ujjwala, thank you for replying. In this next question, they are asking, this question 2-3 times has been asked, that if you are visiting a sub-center and you want to know that the A&M are working well or not, health worker are working well or not, you can check the register. So in the ANC registration, how many pregnancies should be there? So sometimes they give the birth rate, sometimes they don't give it, but 20.2 is the birth rate of India. For every 1000 people, 20 live birth occur. So in 1000 population, there are 20 live birth. And when we are talking about sub-center, I hope you all know that sub-center is at 3000 population in hilly area and it is at 5000 population in plain area. And 85% of population of India is living in plain area. So if they have not given the population of sub-center, we will take it as 5000. So in 1000 population, there is 20 live birth. So if you make this 1000 population 5000, which is the population of sub-center in plain area, then the total live birth will be 20 into 5 or 100 live birth. Now, the pregnancy which we have in a year, this pregnancy in a year has two components. One is the live birth in a year, and then there is 10% of live birth. This is known as pregnancy wastage factor, because of course some abortion will occur, some stillbirth will occur, not all good live birth will occur. So the live birth is 100, and if you see 10% of that, 10% of 100 will be 10. So it will become 110. This is pregnancy in a year. And if they are asking pregnancy in register, register means they are trying to ask that at any time if you visit the sub-center, then how many pregnancies should be there. So usually the registration of pregnancy occur at 12 week, that is the first visit. And as you all know, there is 4 minimum visit in Indian guideline and there is 8 ANC visit in WHO guideline. Both question has been asked. If they ask how many minimum visit, you have to answer 4. How many minimum visit for WHO, you have to answer 8. So pregnancy at any time they are asking, first registration is occurring at 12 week, that means 3 months has gone. And of course pregnancy will remain for 9 months only. You can see my pregnancy also. Probably I will deliver soon in next 3-4 months. So in a year, whatever the pregnancy is, only for 6 months they will be in the register. So whenever they are asking at any time, it means you have to divide the pregnancy in a year by 2. You have to divide 110 by 2. That will be the pregnancy at any time. So the answer will be 55. 55 is not there in any of the option. So you will choose the closest answer, 60. So how many ANC registration? Answer 55. How many pregnancy in a year? 110. How many live birth in a year? 100. So these are the 3 steps of question, and sometimes they can only ask pregnancy in a year. Then you have to answer 110. Okay. I hope you will remember all the 3 steps. Very good. Now, next question. In a statistical study for calculating the effect of a drug on patient sugar level, the test showed significant difference, whereas in reality there was no difference. Which type of error is happening? So I am sure you must have read about this alpha beta error. Type 1 error is alpha error, and in alpha error we overestimate our drug effect, and we forcefully say that our drug is significant when it is not. And in life also we do alpha error. Many times we overestimate ourselves. Like all the people who are high after party, they say ki gaadi aaj bhai chalayega and I will drive the vehicle. But they are not capable of driving, but they are overestimating themselves. So they are doing alpha error. And it's a common thing which we do. Alpha error means saying non-significant as significant. Okay. And there is two line. If you remember that two line, mostly alpha error, beta error question will be done very easily. Alpha error means false positive. Alpha error means rejecting null hypothesis even when null hypothesis is true. Okay, null hypothesis is true but you are rejecting it. That is alpha error. Okay, do remember it. Now what is type 2 error? Of course, the just opposite of it. Type 2 error means when we underestimate ourselves. That is beta error. Okay, and you can understand beta error like whenever you think that some other student, some other boy, girl have more memory power than you. You are doing beta error. You are underestimating yourself. Or let's say you did a research on exercise effect on BP. Of course, exercise lower BP, we all know that. But suppose at the end of a study you said that exercise is not significantly lowering BP. So here you acted as a foolish person. You underestimated your own result. So whenever you act as a foolish person, that is type 2 error, when you underestimate yourself. And whenever you acted as an over smart person, that is type 1 error. Okay. So to understand beta error, you should remember these two words. One is the false negative word we say. Okay. And then the second line will be just opposite to alpha error. Alpha error was rejecting null hypothesis when null hypothesis is true. So beta error will be not rejecting null hypothesis when null hypothesis is false. So you just remember the alpha error line, rejecting HO when true. The opposite will be true for beta error. Okay. So now we can say beta error as saying significant as non-significant. Like exercise is significantly lowering BP, but you said exercise is not significant. That is beta error. And here the same thing is done. Read the line which I have underlined. They are saying that test shows significant difference. Reality, there is some significant difference. But researchers, test showed significant difference, but in reality there was no difference. So that means here researcher is forcefully trying to prove that there is significance when in reality there is no significance. Let me clarify it with an example. Let's take example of coronal study. Coronal study was done on asymptomatic people who don't have fever. But the researcher said coronal can treat fever. So they were doing alpha error. They were giving false positive report for coronal study. The same thing is happening here. The researcher is showing significant difference. That means researcher is showing that coronal can decrease corona fever. But in reality, there is no difference between coronal and placebo in lowering corona fever, because the research was done on those people who are without fever. So in reality, there is no difference between coronal and placebo, but researcher is forcefully proving that there is a significant difference. So here researcher is acting over smartly. He is forcefully trying to prove his no significant drug as significant. That is alpha error or type 1 error. And why understanding this concept is so important? Because alpha error and p-value, they both have same meaning, almost same meaning. The only difference is alpha error we pre-decide in a study that how much time we can give wrong result, and we usually decide alpha error as 5%. And p-value is something which we calculate at the end of a study. That is the difference between them. Otherwise, whenever they ask question on p-value, you have to think that in the 4 option where the researcher is acting over smartly, where researcher is trying to prove wrong thing as correct, non-significant as significant. That is alpha error, that is p-value. Okay, so this is the question here. So if the case is opposite, and Dr. Narayan Tripathi is asking this question, that if the case is opposite, let's say they have written it in a question that tests show no significant difference, but in reality there is difference. It means reality wise exercise is lowering BP, reality wise exercise is useful, and researcher is foolishly saying that it is not useful. So that will be beta error, just opposite of that. Okay, if you want, I can write it and frame one more question. Let me know if you still have doubt in this question. I will frame it in another language and I will ask it again. Okay, chalo. Now population attributable risk, AR and RR, is the confusing area through which they ask question. In recent INICT also they have asked. So remember this point, that in attributable risk and population attributable risk, in both of them we subtract it from non-exposed. So non-exposed should be there in the minus part. Only difference is when we talk about attributable risk, this is exposed minus non-exposed by exposed. Okay, there is no option of attributable risk. It simply means exposed incidence minus non-exposed by exposed into 100. But when we talk about population attributable risk, we just have to replace the exposed word in both the places with population. So PAR will become incidence in population minus incidence in non-exposed by incidence in population. Okay, into 100 of course to get the answer in percentage. So which option will be correct? Either it will be A or C. You just have to see where they are talking about population. Population was there in C, so that will be the answer. Now what was the question in INICT? They ask that if PAR is 60% or some data is there, 60%, what does it mean? Does it mean that incidence is 60% less in exposed, or does it mean incidence is 60% less in the population? So remember, if PAR is 60%, it means that incidence can be decreased by 60% in population, not in exposed, because PAR talks about population. Incidence can be decreased by 60% in population if they are talking PAR. But if they talk about the same thing in AR, then AR means that incidence can be if AR is, let's say, 70%, it means 70% exposed incidence in exposed is due to the risk factor about which we are talking. So remember this point, that when they are talking about PAR, that 40% is the incidence which decreases in the population, and when they talk about AR, it means 70% cases are due to that risk factor, due to that risky behavior. Let me give you a good example. Through that example, we can understand this much better. So let me have some good example of this thing. Okay. For example, let's say that suppose we are talking about one hypothetical situation where there are 100 drunken driver and 100 normal driver. Out of these 100 drunken driver, let's say 60 had accident in a year, and out of these 100 normal driver, suppose let's say 20 had accident in a year. So if they ask you to find relative risk is incidence in exposed by incidence in non-exposed. Remember, relative risk is the best way to find strength of association. If we want to know how strongly two things are related, RR will be the best. And what will be the relative risk in this case? 20 time accident in non-drinker group, 60 accident in drinker group. So that means drinker group are doing 3 times more accident. है ना, ज़्यादा पी रहे हैं, ज़्यादा ठोक रहे हैं, they are drinking more and doing more accident. Simple. RR will come 20 by 60 by 20, 3. Now what will be the attributable risk? Attributable risk, as I said, incidence in exposed, which is 60, minus incidence in non-exposed, which is 20, divided by incidence in exposed, which is 60, into 100. So 60 minus 20 by 60 into 100, that will come 4 by 6 into 100 or 2 by 3 into 100. So 2 by 3 into 100 means it will be 66.6%. That is the AR. So that means 66.6% accident in exposed, who are exposed, drunken driver, is due to drink and drive. And due to drink and drive. But this is in exposed. This is not in general population. This is in exposed. Sorry for writing it behind me. Okay. Now, if they are talking about PAR in this story, then population attributable risk, whatever it will come out, we can calculate it. It will we can get the result, but they cannot give you the questions on calculation because they are not giving you pen in the exam. So let's say PR came, suppose 27% or something. So it means that the accident will decrease by 27% in the drunken driver. If they stop drink and drive, accident decrease by 27% in the whole population. Not only in the drunken driver, but in the whole population, accident will decrease by 27% if truck driver stop drinking driving, okay, or vehicle driver stop drinking and driver. So remember this point, that whenever they talk about relative risk, they will use the word time. Whenever they use the question on AR will use the word due to. And whenever they talk the question of PAR, they will use the word decrease by. And PAR will talks about the prevalence in population. AR and RR talks about increased cases in the exposed, not in the population. Okay. Does it make sense? RR, AR, PAR? Okay. Chalo. Now, let's move ahead. Let's do this question on school closure. This question I have given just to give you an example that with your presence of mind, even if you don't know this type of thing, you can rule out other option and you can give the correct answer. So all of the following support this except. They are asking the question that why are we recommending school closure during outbreak? All three will be the reason except which cannot be the reason. So if you read at the last line, playing together increases transmission. That can be one reason of closing school during corona or flu. Increased rate of transmission due to more opportunity. That is also true. Children are most commonly affected by swine flu. It can be true. But closure of school will not lead to reduction in contact. If it is not leading to reduction in contact, then why are they closing it? It means option A can never be the answer. This is not a true statement. So if you have, if you are cool-minded, relax in the exam, then you can do these questions without knowing about them. Okay, so except answer will be A. Because if closure is not leading to reduction in contact, then why would they close it? Okay, of course, it lead to reduction in contact. So that is question, answer was A. Now, next question. You are a doctor, you are visiting a village and you want to know how much is the infant population in that area. Which measure can you use? The TT injection measures we cannot use because many tetanus is given for trauma cases also. So it will be an overestimation of infant. Folifol tablet is something which is given in the folic acid tablet especially, which is given in the first trimester of pregnancy only, usually. It can be given in other causes of microcytic anemias also, nutritional anemia also, but mostly it is given in the first trimester of pregnancy. So it can tell us how many female are in the first trimester of pregnancy, and hence it can tell us how many is the infant population in that area, because we just came to do that question, that if you know the live birth, you can find the pregnancy. So similarly, if you know the pregnancy, you can find the infant in that area. Let's say the pregnancy in a year is 110. It means infant or live birth will be 100. है ना? If you reduce 10%, pregnancy in a year minus 10% will give us infant or live birth population. So if we know how much folifer tablet is there, we can find out how many live birth or infant are there. So this is the correct answer. Now, you can answer it again by ruling out other option. Literacy do not tell about infant, because it is literacy rate is calculated after 6 years of age. How many people can read or write with understanding of that language. Now, if you look at option C, female population in reproductive age group. There can be many female in reproductive age group and they are not pregnant. So it will not tell us about how many infant are there. Folifer tablet will tell it better, definitely. So now one question which we generally ignore is the question on Chandler index, and it is asking what it will tell. So Chandler index is used to know what is the burden of infection. Load means burden of infection in any community. What is the burden of infection? It can tell us whether worm infestation is a common problem in that area or not. It can tell about endemicity. It can tell whether the worm infestation control program like Anemia Mukt Bharat. This Anemia Mukt Bharat is not only to decrease anemia. It has two targets. First target is to decrease anemia each year by 3%. This question came in recent exam. By how much percentage we want to decrease anemia? So it is decrease anemia each year by 3%. And this we compare from 2015 data, because this program was launched after that. So every year from 2015, anemia should reduce each year by 3%. This is first target. Second target is to prevent worm infestation also. And therefore, to prevent worm infestation, we are giving albendazole tablet twice a year. One time of giving albendazole is 10th of February. That is our National Deworming Day. And the other time of giving albendazole tablet is 10th of August. So 5 days before Independence Day and 4 days before Valentine Day. If you met anyone, any boy or any girl 4 days before Valentine Day, what will you give to that person? One tablet of albendazole. And of course, the person will ask, "Abhe, pagal hai kya? Are you crazy or what? What are you giving this tablet to me? What do you want me to do?" So then you will say, "Ki this tablet is to kill your worm. तुम्हारे कीड़े मारने के लिए दे रहा हूँ. This is only for 2 days in a year we give it, because it is for prevention. When we are treating by albendazole, we give it today and after 14 days. But it is only for prevention." So this Chandler index, if the Chandler index is less than 200 egg per gram of stool, it indicates that worm infestation is not a problem in that community. If it is between 200 to 250 egg, that means worm infestation can be a potential problem in future, or it can become a problem. If it is between 250 to 300 egg, it means worm infestation is a mild problem in the community. But if it is more than 300 egg per gram of stool, it means that worm infestation is a severe problem in the community and we need to do mass deworming by giving albendazole tablet to all the people of the population. Okay, so this is the cutoff. Do remember, less than 200 not a problem, more than 300 big problem. Okay, do remember it. Acha, what comes 4 days before Valentine Day? Hug day? Is it hug day? Right, some days there. I think it's Teddy Day or something. So on that day, don't forget to give albendazole. Okay, so do remember it. Answer will be this. Chandler index do not tell about how serious is the patient and whether he will recover or not. It only tells us that is worm infestation is a problem in the community or not, whether program is working or not, what is the burden of disease in that area. Okay. Chalo. Next question is based on sensitivity specificity concept. So the upper part is usually not useful in this type of question. From the part from which data start, we have to focus there. So the first line is saying 60 out of 100 women who tested positive for this test had ovarian cancer. So that means 60 are disease and 100 are total positive. And what they are asking in the question is negative predictive value. Negative predictive value has nothing to do with positive part. This 60 have the disease among positive. So in the positive there is true positive plus false positive. So 60 is true positive. But we don't have to do anything with the true positive in this question. So let's look at the other part. 20 out of 100 women who tested negative had ovarian cancer. So that means there are 100 who are negative, and out of these 100 negative, 20 have disease. Disease but negative. So the question of from all of you is, what will you call these people who are having disease but negative? Because in the negative there is two things. One is true negative, one is false negative. So this 20 people who are having the disease but still they have negative report, are they true negative or false negative? They are the one who were miss out. Very good. False negative. Correct, Devika, Ujjwal, AV, Neha, Trilok Chand, Dhana Sai Teja, all of you are right. Because they have disease but they wrongly came negative. So because they wrongly came negative, it is false negative. So that means they have given you the false negative. False negative is 20. And they have given you the total negative, which is 100. So if 100 is total, false negative is 20, how much is the true negative? True negative will be 80 because 80 plus 20 will be 100. So that means we have been given true negative is 80 and total negative is 100. And I hope you all know that NPV means true negative by total negative. So true negative is 80 here, total negative is 100. Answer will be D, 80 by 100, which already Gitsudhar Kishore Kumar already had given the answer. Okay. If they ask PPV in the same question, suppose positive predictive value they ask, then positive predictive value is directly 60 by 100 because positive predictive value is true positive by total positive. So it is 60 by 100. Okay. So in this type of question, we need not to use pen. So they can give such type of calculation in exam. Okay, dear. Do you also want me to calculate sensitivity specificity here? Not a big thing to calculate, but they are not asking it. So but if they ask sensitivity, because they can ask you to identify the correct formula of sensitivity specificity also. Sensitivity means true positive by true positive plus false negative. And it's very easy to remember this formula forever. In your life, you will never forget it. Just remember that sensitivity is true positive rate. True positive is in the numerator, which you already remember. So if true positive is in the numerator, denominator will be true positive and just opposite of that. What is opposite of true? False. What is opposite of positive? Negative. So just remember true positive, you will never confuse in the formula. Similarly, they can ask you identify the correct formula of specificity. Specificity is true negative by true negative plus false positive. So again, we just have to remember that specificity is true negative rate. True negative is in the numerator. The denominator will be true negative and just opposite of that. Opposite of true, false. Opposite of negative, positive. So just remember sensitivity, true positive, and denominator just opposite of that. That is false positive and true positive. Like that, you can answer it even by closing your eye, and I hope you will not confuse in this formula. So we can apply the data here and we can find it easily. The data is already there. Okay. Chalo, now let's move ahead. In next question, they are asking that some female ingested rye and they are complaining weakness in both the lower limb, nausea, fatigue. Now she is completely unable to walk. What is the most likely cause? So, this ergot alkaloid, these are present, ergotoxin they call this toxin. These are present in rye or wheat contaminated with claviceps purpurea. Okay, and if this claviceps purpurea fungus is there, which is releasing in ergotoxin, then the role of ergotoxin is, like you must have read this sumatriptan or ergotamine group of drug which are used for migraine treatment. How they relieve migraine? They relieve migraine by constructing the abnormally dilated vessel and the patient feel better. So here also, if we have ergotoxin in wheat and rye, that will cause constriction of peripheral arteries and all, and that will lead to necrosis of peripheral fingers or peripheral foot, finger and toes. So this is the main symptoms of ergotoxin thing. Okay, there can be some nausea, vomiting thing or LSD like effect, some psychedelic effect can be there also with ergotoxin. Now, this argemone mexicana, that is something which is mixed with mustard oil. So argemone mexicana in mustard oil if you add, that will lead to epidemic dropsy. Epidemic dropsy. And the poison for epidemic dropsy is sanguarine. This food adulteration topic is such a topic from which usually one question come every alternate year. And in epidemic dropsy, which I am discussing, the symptom will be bilateral pitting edema. Okay, bilateral pitting edema. Now, the other is this crotalaria plant. This crotalaria plant have the toxin pyrrozolidine, and due to this pyrrozolidine there will be endemic ascites. Okay. So now the main confusion occur between endemic ascites, epidemic dropsy, what is their poison they ask, and we get confused sometime. So to remember it clearly, I used to imagine, you also should imagine this. Imagine that you are sleeping with someone of your dream. Okay, good imagination now, go there. So probability is you will not sleep, you will be busy in something. But if you slept, what will happen? There will be dropping of eyelid, dropsy will be there if you slept, and the symptom is also pitting edema. Pitting means it is going inside, dropping inside. So this weird way can be used to remember this thing, that dropsy occur when we sleep. S is also sanguarine, S is also sleeping, and anyway in sanguarine there is sung, that's why I thought about it. Sung is a Hindi word which means together, and you are sleeping together like that. So if you are sleeping, that is dropsy, that is pitting edema. So sanguarine cause epidemic dropsy or pitting edema, and pyrazolidine cause ascites, okay, which is in crotalaria plant, which is also known as junjunia, okay, because when wind blow, this sound produce, the wind produce a very good sound in crotalaria plant area. The sound is jun 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 jun. So that is there. Now, one thing is this Lathyrus sativus. This Lathyrus sativus is the scientific name of khesari, which is known as khesari. And this khesari is a spinach or a sag. And if someone has taken khesari sag for a very long time, in the khesari sag there is this poison beta oxalyl aminoalanine, and they have asked a question in NEET exam already on it, that a patient came from rural part of Chhattisgarh and he had history of eating some spinach, and due to that spinach there is spasticity around hip joint. Hip joint will not be flexible. That is the first stage of neurolathyrism. What is the first stage? First stage is spasticity around hip joint. After spasticity around hip joint, in the second stage, the patient need one stick to walk. So that is one stick stage. They can give you an image of one stick stage and they will ask that which stage of neurolathyrism is this. So if one stick is given, that is not the first stage. One stick is second stage of neurolathyrism. First stage is spasticity around hip joint, khesari or Lathyrus sativus, poison boa. Now, we have read about 4 toxicity. The last 5th is very commonly asked this day, that someone eat contaminated groundnut, and after eating contaminated groundnut or maize, the person develop hepatocellular carcinoma. Hepatocellular carcinoma of liver, of course. So which toxin is released here? Here the toxin released is aflatoxin, they ask. So if they are asking about liver carcinoma, of course Aspergillus flavus fungus contaminate groundnut and maize and release aflatoxin, which cause hepatocellular carcinoma. So these are the food adulteration. Let's quickly revise it all together. First thing, if they give rye or wheat with ergot, that is ergot toxicity, rye or wheat, and there will be necrosis or cyanosis of peripheral finger, ergotoxin will release. Second point, if they gave Argemone mexicana in mustard oil, poison is sanguarine, S for sleeping, dropsy, pitting edema. If they gave crotalaria junjunia plant, pyrazolidine is there, which cause ascites. Ascites is endemic ascites, okay. Anyway, junjunia is endemic name, and it very beautiful name, probably from some tribal areas. And the 4th is Lathyrus sativus khesari, which has poison boa, and we can do paraboiling to remove this poison also. The first stage is spasticity around hip joint. Last thing, if they give contaminated groundnut and maize and hepatocellular carcinoma, that means aflatoxin is released by Aspergillus flavus fungus. Okay, do revise this 5 before every exam. Next question. Very good, dear. You all are answering with me. I really like it. Thank you. Shukriya. Very good. Now, next question. A study was done on 3 states to see the mean blood pressure of each community. Health workers were assigned as they visited each house in 3 communities. Mean blood pressure in each community was found and compared. So, which study design is represented here? A very good way of finding out which study design is that whenever they say case control study or cohort study or RCT, okay, These three studies usually have two groups of participants from the beginning. In RCT, they will also use the word randomization, that we are giving drug to one group and comparing it with other group. So RCT can easily be found, but sometimes we get confused between case control and cohort. But it's not so confusing, because always remember that case control will start with, if it is case control, it will start with outcome present and outcome absent, like disease present, disease absent. That will be case control, because that outcome present is case, outcome absent is control. Now, if they ask the question starting with exposure present and absent, then the answer will be exposure present, exposure absent, answer will be cohort. But you can see here, there is no two group. We are just doing a survey in the community. We are measuring their BP and comparing the differences. So definitely this type of study will be cross-sectional. The other name of cross-sectional study is snapshot study or prevalence study. Because in this study, we try to know the prevalence, that how many people have hypertension in the village. So in cross-sectional study and ecological study, in both of them usually there is one population they give. So how will you differentiate between cross-sectional and ecological? The difference is, in cross-sectional we collect data from every participant. From every participant we will ask something, or we will collect their BP or something. But in ecological study, we do not collect data from anyone. That is why ecological is known as correlational. We simply correlate population data with hospital data. Okay? So, in correlational study, no question is asked from participant. In cross-sectional, we ask it from everyone. And cross-sectional ecological, one population, case control cohort, two population. Now, one of the common question in case control that they are asking these days is that in a village, cases of ALL cancer is coming more than expected. So in this study, what will be the two group if you are doing a case control study on this thing? Of course, if we are doing case control study, one group will be ALL present, one group will be ALL absent. But the question they ask is, will you take the participant from the same village or from different village? So, if they have not given you any history that why the cancer is occurring, then we should match the participant in case control study, then recruit them. So they should be from the same village if they have not given the reason of cancer. But suppose in the question they have given the reason of cancer, that ALL is suspected to be due to soil or water. So if it is due to soil or water, then we cannot take them, the two group from the same village, because then it will not be matching, it will become over matching. So if it is due to soil or water, then they should be ALL present absent, but they should be taken from different village. Okay? So if soil or water is the reason, different village. If soil or water is not in the reason, same village. Third question that they have asked really in previous year is, from this point is, that suppose you have taken ALL cases from the hospital ward. Now where you should recruit the control from? Cases are coming from hospital ward. Where the control should come? Option A, should they come from same ward? Should they come from same ward with ALL? Or should they come with any other ward? Or should they be taken as OPD patients without having ALL? So if you have taken ALL cases from pediatric ward and you took control from other area, this is not matching. They will be totally different. So you have to take, if the cases is taken from pediatric ward, you will take the control without ALL attending OPD. Okay. So cases of ALL, do I need to write it? Like ALL cases from pediatric ward. So where will you take ALL control from? ALL control will be taken from pediatric OPD. And of course, because they are control, so ALL will be absent here, and because they are cases, so ALL will be present there. So these are three questions that they can ask. If they said there is no reason of cancer, they should be from same village. If the reason of cancer is water soil, then they should be from different village. And if you have taken pediatric ward patient, you will take the control from pediatric OPD. Okay. Now, if you still want, very good, very good. If possible, we can take it from pediatric ward also without having ALL. But if in the option it is not given pediatric ward without ALL, then you can take it from OPD without ALL. Okay, pediatric OPD or ward without ALL. Okay, without ALL. If you have a difficulty in understanding cohort case control, how to identify them, let me know. I can give you some example for that. Okay. Thank you, NMDA agonist, for appreciating. Shukriya. Chalo, Devika got it. Thank you. So next question, which of the following is the best for determining the threshold for diagnosis of a positive test? Okay. Threshold of diagnosis or cutoff for a test. This is diagnosed by receiver operating curve. In receiver operating curve, we draw line between false positive rate, which will be on x-axis, false positive rate, and true positive rate, which will be on y-axis. True positive rate, as I said earlier, stand for sensitivity. So we draw sensitivity on y-axis, and false positive is equal to 1 minus specificity. So 1 minus specificity is on x-axis. And you can get an image based question also from ROC curve. How will be the image? Let me tell you. Suppose we want to know what is the cutoff for fasting blood sugar, which is 126. So initially, if you took cutoff at 90, true positive and false positive both will roughly be the same. So this fasting blood sugar 90 cutoff is a useless cutoff, because it is giving 50% as true positive, 50% false positive. So rather than using 90 as cutoff, we can toss a coin. Head come diabetic, tail come non-diabetic. And it's useless test. So now if you increase the cutoff, let's say from 90 to 110. So at 110, true positive you can see is still 20, but false positive became almost 10. So that means 110 is a better cutoff than 90. Now if I increase the cutoff further to 126, let's say, at 126 you can see true positive is 20 and false positive is hardly 1 or 2. So which is the ideal cutoff? The one with highest slope is the ideal cutoff. This highest slope ideal cutoff. Why? Why highest slope is ideal cutoff? Because this slope of y and x axis, this is telling us how much is true positive as compared to how much is false positive. And this is known as likelihood ratio. Okay. Now, true positive is sensitivity, false positive is 1 minus specificity. So the formula for likelihood ratio will be sensitivity by 1 minus specificity. Okay. What does likelihood ratio means? Likelihood ratio simply means what is the chance of disease out of positive rate. And out of true positive, false positive, who have disease? True positive have disease. So that's why we are putting true positive above, because likelihood ratio means chance of disease out of positive rate. What is the chance of disease? Okay. Similarly, this is known as positive likelihood ratio. Likelihood ratio, positive likelihood ratio. So that means the greater the slope will be, more is the chance of disease out of positive rate. So that is why we take maximum slope as the ideal cutoff, because maximum slope will tell us maximum positive likelihood ratio. Okay. So ROC curve, what does it give? It gives us positive likelihood ratio, and therefore it gives cutoff for test or threshold for test. And if you get an image based question like this, that will be ROC curve, of course. Okay. Now, positive likelihood ratio is sensitivity by 1 minus specificity. And if you look at negative likelihood ratio, that will be 1 minus sensitivity by specificity. You just have to shift the 1 minus from denominator here to numerator here. Okay. So, what is negative likelihood ratio? This is chance of disease out of negative report. Out of negative rate, what is the chance of disease? So it is telling us false negative rate by true negative rate. Okay. Chance of disease out of negative rate. And in the negative rate, who have disease? False negative have disease or true negative have disease? Of course, we just discussed it. False negative are miss out. They have the disease, but they were not being caught. So that's why we put false negative in the numerator, true negative in the denominator. Okay. So that is there. I hope you will remember the two formula. I will summarize this two formula again. When we will read about a skewed curve, I will discuss it again in one more question. Focus here first. Next question, they are saying that which of the following is used for selecting patient with respect to potential factor that will affect the result? Potential factor that will affect the result means they are trying to show that there is heterogeneous population. Heterogeneous population is the one population which is different from each other. For example, let's say I want to know what is the prevalence of smoking in medical students of Aligarh Muslim University, in medical student of Delhi, and in medical student of let's say Lucknow. 3 cities are there. I want to know where they are smoking more sutta. Okay. So if I want to compare the student of Lucknow, Delhi and Aligarh, and I compared them, suppose, by simple random sampling. So in simple random sampling, everyone have a very equal chance of selection. That is why simple random sampling is best for homogeneous population which is similar to each other. So if I am taking it by simple random sampling, that in Lucknow, then in Lucknow I can get 8 boy out of 10 student house. Suppose I am selecting 10 student and asking from them, are you smoking sutta or not? So in Lucknow I can get 8 boy and 2 girls, suppose. In Delhi I got 5 boy, 5 girl. In Aligarh, suppose I got 8 girl, 2 boy. Because if we are doing simple random sampling, in simple random sampling we select people by lottery method. And we will just take the name of some people in computer and we can randomly find any 10 people. So if the data is there like this, then I know in Aligarh Muslim University I have done my MBBS. So I know their girl used to smoke less. Okay. So if I did like this, 8 girl, 2 boy, the result will come that Aligarh medical student are smoking very less. But it's not correct for boy. They are smoking high. But when I did simple random sampling, I wrongly got 8 girl, 2 boy. So the data came very less smoking, which is the wrong data. So what I should have done? In place of doing simple random sampling, I should have done stratified random sampling. What is that? I should have divided the boys and girl of the class and then choose 5 from boy, 5 from girl in Aligarh also, in Lucknow also, and in Delhi also. So if I choose 5 from boy, 5 from girl in all the 3 states, then the result will be comparable, because now boy girls are similar, so we will know the exact prevalence. This is known as stratified random sampling. So you can see here, we did stratified random sampling when population is different from each other. Like in terms of smoking, in terms of accident, boys and girls can be different. So they are heterogeneous population. So whenever they are different in respect to the question being asked, then we do stratified random sampling. Okay? And if they are similar in terms of question asked, then we will do simple random sampling. Let me give you a good example to understand it. My study in PG was based on organ donation, and my guide said that to find 1,000 people, do simple random sampling, and from 48 villagers choose any 1,000 people, interview them, and let know whether they want to donate organ or not, what are the factor which is increasing organ donation or decreasing it. So we did simple random sampling thinking that all the villagers are same. Okay? That is simple random sampling because everyone is same, homogeneous population. So simple random we did. But there was a question in my study that whether religion promote organ donation or not. So when it comes to religion, population is different, Hindu, Muslim and Sikh population were there. So in my population of Haryana area, there was only 2% Muslim. So 2% Muslim means out of 1,020 people are only following Islam. And based on 20 people opinion, I cannot tell whether organ donation is something which is promoted by Islam or not. We cannot comment on Islam based on 20 people opinion. We need a large sample size. So in my study, villagers were different in respect to the question, in respect to the potential factor, they were different. So what I should have done? I should have done stratified random sampling. From the beginning of study, I should have taken the population, divided them into Sikh, Hindu, Muslim and said, I will choose 400 Sikh population, 400 Hindu population, 400 Muslim population. Then I will get equal representation from all the 3 population. And then I can comment whether Sikh religion or Islam or Hinduism is promoting organ donation or not. So whenever villagers are different in terms of question, in terms of potential factor, we will do stratified random sampling. And when they are similar in terms of question, we will homogeneous population, we will do simple random sampling. Okay? Now, if they ask this question in exam, and they have asked it already, that suppose you want to know that villagers are using condom or not. Okay? What do you think? Are villagers using condom? So, to know this thing, we can interview every first and fourth house. Every first and fourth house in village is interviewed. So it will be which type of sampling? Which type of sampling will be here? We are interviewing first and fourth house. So we are following a system here. First, then second, third is not included, fourth included. So we are following a system here. Systematically we are choosing them. And first and fourth number must have come randomly. So this will be an example of systematic random sampling. If every 10th student is selected, 20 is selected, 30, 7th student selected, like that they said, answer will always be systematic random because we are following a system. Okay. Now, in cluster random sampling, we choose the whole cluster. Like a very good example of cluster random sampling is WHO immunization study. Suppose I want to compare whether Bihar has more immunization rate or Uganda have more immunization rate. Okay. So I will take 7 children from 30 village of Bihar and 7 children from 30 village of Uganda. And I will ask from their mother, are they immunized or not? So in this 7 children, they are coming from same villages now. So they are cluster of people who are being selected, and then we interview them. So let's quickly summarize all this sampling technique. If in a class I have to choose, suppose from this online batch I have to choose 10 people for a party after the class. And suppose is the main word. So if I randomly select any 10, it is simple random. By lottery method, simple random, homogeneous. If I select 5 from boy, 5 from girl, so that they can also have good time together in that party, and they can also with some more love. So that will be stratified because I divided, then I selected you. If I am selecting every third response student, that is systematic random sampling. And if I select the whole student who replied first 5 student who replied, that is cluster random sampling. But it will not be a good example. Cluster random sampling means, let's say you are doing intervention on one village and you are comparing with other. It can be cluster, or immunization study can be cluster. Okay. But the last type of sampling is multi-stage sampling. If they give a question on multi-stage sampling, they will give you image of a big something, like this is suppose Delhi, and from Delhi they will choose a small area, 4 area, then they will choose 3 colony each area, then they will choose 2 school each colony, like that. That will be multi-stage sampling. Multi-stage sampling simply means from one large area we choose a small area and we do study on this school, and we will say this is the data for the whole Delhi. Okay. So this image type of question can come in multi-stage sampling. Chalo, now, thank you, Meenu. Next question is the question of Anganwadi center. First question for all of you is, what is the age limit of children in Anganwadi? Is it 3 year, 4 year, 5 year, 6 year? What is the age limit? Second, which indicator they use in Anganwadi? Weight for age, height for age, weight for height. So before that, tell me one thing. This weight for height which is there, is it indicating acute malnutrition or chronic malnutrition? Weight for height. Very good, Aditya Aruni, you are right. And thank you Jeetu, Barfi and friend and Neha for replying. Answer is 6 year. And today only in the newspaper government has said that 6 years should be stage for first class. First class 6 year. So in Anganwadi also we take children before 6 year up to 6 year. And if suppose someone has low weight for height indicate acute malnutrition or chronic? That is my question. Pooja Yadav and Charan B are saying acute. Answer is definitely acute. Very good, Pooja Yadav and Charan B, you are right. Low weight for height means height is good but the weight is less. Sook gaya hai banda. Wasting. Low weight for height is wasting. It means the child has eaten well since birth, but now he is not eating well. So that is acute. Now what is weight for age will tell. If someone has low weight for age, will it tell acute malnutrition or chronic malnutrition or both acute and chronic malnutrition? What does it indicate? Very good, Pawan Kisarwani, Adnan Bijapur, Githu Sudar, Neha, sorry for if I pronounce wrong your name, kindly forgive. Very good. So remember this point, low weight for age indicate both acute and or chronic malnutrition, and height for age indicate chronic malnutrition. Like imagine me as a malnourished child, full malnourished. So I can be malnourished because my mother has not given me since birth. That will be chronic malnutrition. My weight can be low because of that. Second reason, that my wife is not giving me food since my marriage, so that is acute malnutrition. So it can be that any one of them has not given me food, acute or chronic, which can reduce my weight, or they both are planning together to keep me malnourished. So that will be both acute and chronic. That's why we use the word and or. And or means they can be together or they can be separately responsible for low weight of the child. Okay, and of course I hope you all know, if height for age is low, that indicate chronic malnutrition, and chronic malnutrition is known as stunting. That is why we are using weight for age in Anganwadi, because weight for age will not only tell about acute malnutrition, it will also tell about chronic malnutrition. So we use weight for age in Anganwadi. Okay, very good, correct, Adnan. Chalo, now next. Acha, this is the opposite. And Dr. Narayan Tripathi had asked me this question, that what if it is opposite? And this is the question of opposite. Study find no significant association between two variables, but there is a difference. So truly there is difference means study is significant in reality. In reality, study is significant, but researcher underestimated the study result. Researcher acted as a foolish person and researcher said non-significant result. So here you can understand that researcher is underestimating his or her own drug. He is not giving value to his or her own study, and that is beta error, type 2 error. Okay, so significant in reality but non-significant. That means researcher is giving false negative report. He is saying my drug is negative, useless, my study is useless, but in reality it is useful. So that is type 2 error, beta error. Now, random error is something which occur due to small sample size. The natural variation which is due to small sample size, that is random error. And systematic error is known as bias. It occurs when we collect data wrongly, or when we do selection bias, or when we do error in analysis of data. So if you want to decrease random error, increase sample size and random error will be less. And if you want to decrease the systematic error, then sample size will have no effect on that. Okay, so remember, random error can be decreased by increasing sample size. Okay, I hope this type 1 type 2 error was clear to you. Pooja Yadav is asking answer for previous question, weight for age dear, because weight for age, if it is low, it indicate both acute and chronic. So that is the answer. Okay, chalo. Now next question, this is the question on a skewed curve, which they have asked in recent INICET and before that also 2-3 times they have asked. So if the bar is in the center, it means the imaginary curve will be normal. So plot 1 will be normal. If the bar is in the lower side, then this is a box and whisker plot, and in box and whisker plot the first line is 25%, upper line is 75%. So then you can have an imaginary curve in which the skewed part is between 40 to 75. So you can see here, a skewed part is towards larger number. And in your life, if you are moving towards larger number, your marks are increasing, money is increasing, are you positively skewed or negative? Of course, positive skewed. So if the bar is below and the skewed part is towards bigger number, this is positive skewed curve. Okay, so this line 3 with bar below, 3 is positive skewed. Okay, and if you draw a plot with bar above means imaginary curve, if you draw, the skewed part is between 60 to 25, which is lesser than 60 to 75. So here this is the skewed or stretch part, and it is towards lesser number. So because it is towards lesser number, we will call it negative skewed. Okay, so the correct answer is B. Do remember, if they draw a plot with bar above, this is negative skewed curve. With bar below, this is positive skewed curve. Okay, positive, negative. Now, to remember it in a different way, I was taking this class in Jaipur. A student came to me and said me in my ear that, sir, there is a secret way by which we can remember it always. Whenever he took the bar as the thought of sex and all, and he said that whenever we are focusing on study and thought of sex is below, not in our head, then we are positively studying with full attention. But when the thought of sex reach into our head, that is the time when we are negatively skewed in our life. So when the bar is in the head, negative skewed. Bar is below, positive skewed. Now the same concept we can also use to remember the formula of positive likelihood ratio. So remember, when are you positive in life for exam? When the bar is below. So in positive likelihood, the minus sign will be below and sensitivity will be above. This is positive likelihood. But when I write negative likelihood ratio, then the bar goes into head and we are negative. So negative likelihood ratio 1 minus sensitivity by specificity. So you can use the same concept to remember these two things together. Bar below, positive, all is good. Bar goes into head, negative skewed. Okay, so bar above, negative likelihood ratio, bar below, positive likelihood ratio. Sensitivity by specificity is in both the formula. Okay, so we can use that to remember it. Chalo, I hope you will not confuse here with this weird example, of course. Next, a researcher selected all possible samples from a population and plotted their mean on a line graph. If they are plotting possible sample mean on line graph, that is known as sampling distribution. Sampling distribution means, let's say, from the whole population of medical college student, I want to know how many movie they watch in a month. So I can get different sample, one sample of Aligarh student, one sample of my AIMS New Delhi student, one sample of MAMC student, like that. I can get different samples which are watching different number of movie per month. Okay. So all these are sample of a student which are distributed in the population. That is known as sampling distribution. A similar question they have asked in one more INICT exam is that if we are writing probability of random event occurring within a time interval, then what will you call it? Whenever they use the word time, probability of random event with time, this is known as Poisson distribution. Okay. So random event with time is Poisson distribution, and a representation of mean of sample, if you can represent it on a line diagram also, that will be sampling distribution. An example, Poisson distribution is something which is used for sporadic pattern. Sporadic pattern also means no fixed pattern. Like let's take a clinical example. Suppose you are tracking number of dog bite cases which are coming to your hospital on any day, Sunday, Monday, Tuesday and all. So of course on Sunday there can be 4 or 5 dog bite, Monday, Tuesday no bite, or Tuesday 1 dog bite. Hai na? So this type of distribution will be Poisson distribution because they are representing random event with time. You understand now? Like let's say suppose I want to know the number of kisses which you will get in your lifetime. Okay. So when you were small and all, every day you got multiple kisses, father 10 kiss, mother 20 kiss, like that. Then you started saying, hey, don't wet my cheek with your kiss, and you stopped the kisses and all. Then you went to college, got some kiss, then exam came, kisses decreased. Then after exam, kisses increased. So it's all random and it all sporadic. and we should be hopeful. Any case can come anytime. So if you are representing random event with time, that is Poisson distribution. Okay, mean of sample in a population represented by sampling distribution. Next question. Which of the following is not true about randomization in a clinical trial? Remember, when we do randomization, then all the disturbing factors, confounder, they got equally distributed in the two group. So it reduces confounding, randomization reduces confounding, both known confounding and unknown confounding. Okay. Now, randomization decreases selection bias. Of course, randomization simply means that we are putting some chit and we are asking the people to choose A and B. If they go into A group, they will get the drug, B group placebo, like that. So in randomization, we are not selecting anyone. So it removes selection bias. It is the best way to decrease selection bias. Selection bias best decreased by randomization. You understand now? Like, if somebody asks what is the method to lose weight, best way is don't eat. Similarly, what is the method to remove selection bias? Don't select. Allocate them randomly by lottery method and there will be no selection bias. Okay. So that is there. And of course, if we do randomization, the comparability of the two group will be high. The two group will be similar. But randomization does not increases external validity. It does not increases external validity of trial. So what is external and internal validity? Let's understand that. It's a very simple concept. Internal validity means the two group which you have taken in the study, they should be comparable. Two groups of study are similar. Okay? Are comparable. For example, if we are doing randomization and matching, so randomization and matching will make it sure that the two group are similar. Suppose you want to do a trial on knowing whether anxiety is more, what is the level of anxiety in MBBS student, and you took one group who are between 20 to 25 year, other group also who are between 20 to 25 year. So this both are comparable. So internal validity is high. But if you took one group as 20 to 25, other group as 30 to 35, then their age group is different and their internal validity is low. They are not comparable. Now, what is external validity? External validity simply means generalization. External validity means result of study can be applied on general population. Let's say in a anxiety study, if you took participant between 18 year to 80 year, you have taken a large age group, now it can applied on general population. Okay? And if you have taken participant only between 20 to 25, it cannot be applied on all the population. So external validity will be low. External validity simply means generalization. And this was also one of the question in INICT exam, that which increases external validity. Option A, randomization. Option B, matching. Option C, generalization. So remember, generalization increases external validity. Randomization and matching increases internal validity. It's not difficult concept to understand. You have seen some people who are very happy from inside, so their internal validity is high. But let's say their social media don't have any follower, Insta, Facebook, they don't have any follower. That means their external validity is low. And then there are some people who have huge follower on Insta and Twitter and all, but they are not happy from inside. That means their external validity is high, but their internal validity is low. Okay? and then there are some people who are having large number of followers and they are happy from inside also. So that means their external internal both validity is high. Maybe they are also high, you don't know. So this is the concept which we apply for study also. And remember this table, you will not do any question wrong here. Okay, randomization increases internal validity, does not increases external validity. Okay, so next question. Very good. Athar Batwe said increase in sample size also increases external validity. It can increase but not necessarily. Suppose in that anxiety trial, if I am doing the comparison, if I am recruiting only 20 to 22 year people in the study, so even if I am taking 10,000 people of 20 to 22 year, still it will not be applicable on general population. So it can increase external validity but not always. Okay, so you are right, Atharv, but not always. Okay, very good. Neha is saying, sir, can you repeat why not option A? Neha, they are asking not true, and randomization make the two groups similar. So it always reduces confounding, and a randomization is in fact the best way to remove confounder. So that's why option A is true. So they are asking not true, that's why A is ruled out. Neha, if you need any example to understand it, let me know. For example, let's say I am doing a study to know whether OCP causes breast cancer or not. And suppose in the OCP user, I have taken 20 to 30 year female. And in the OCP non-user, I have taken 40 to 60 year female. So which one will have more breast cancer? Of course, these female who are old age, they will have more cancer. So here, this old age is acting as a confounder, because this age is associated with non-OCP user and this old age is also associated with more cancer. So confounder is something which is distributed unequally in the two group. Like you can see here, one group is young people, one group is old people. So confounder is unequally distributed and it is related with both exposure and outcome. Like here, old age is associated with both not OCP intake and more cancer. So how will you remove this confounder of age? To remove this confounder of age, select people randomly. Do not distribute young and old in two group, but ask all the female who are coming for the study to choose from the chit. If they choose chit A, they will get OCP. If they choose chit B, they cannot get OCP. So in that way, young and old will go equally in the two group and confounder will be removed by randomization. So that's why randomization reduces confounding. Okay, do remember this point. Now, next question. In a study, two groups of newborn are checked for their weight based on whether their mother received food supplement or not. So, which test will be applied? Very common area of confusion. The way to find answer to this type of question is, if there is two or more group of participant and sample size is more than 30 and data is qualitative, or which data? Outcome data. Outcome data is qualitative or categorical. In that case, we will use chi-square test, okay, which is known as chi-square also. So this qualitative data, they are represented in percentage or proportion. If you found some data in percentage proportion and there are two or more than two group of participant, answer will be chi-square test. Now, if there is quantitative data, quantitative data which we can measure. Quantitative data is also known as continuous data. Quantitative data are in mean or average, usually like average BP, average weight, average height, all those things. So if there is quantitative data and we have collected pre and post test data, okay, or match data. Match data means where you are recruiting similar participant. Like in our previous study, if you are giving OCP to 20-year female and in the non-OCP user also you are taking 20-year female. So you are taking 20-year female in both the groups, you are recruiting them after matching. So if pre, post and match word are written in the question, in this condition we apply paired t-test. And paired t-test is also known as dependent t-test. Okay. Now, if the quantitative data is there and there is two group and in the question pre, post, match word is not written, we will apply unpaired t-test. Unpaired t-test is also known as independent t-test, and this is also known as student t-test. I was very happy when I heard this name for the first time, student t-test. I thought something is on the name of a student. But then I came to know student was the name of the scientist who found this test. I said, what a strange name, student. Imagine some student have the name teacher and it will be fun to throw him out from the class. Teacher, go away. Teacher, give egg. It will be good. Anyway, so this is unpaired independent. I hope you understand the concept. Now there are two groups. So they are unpaired, independent. Okay. We are not collecting the data before, after or matching them. And if there is three or more group, in case of three or more group, we apply ANOVA. Okay. So 99% of time, if they ask question from this part, they will ask these four things. Remember, very simple. First, you will see whether the data is in outcome data is in category or it is in percentage proportion. You will answer chi-square test if there is two or more group. If the outcome data is pre-post or matched, you will apply student dependent t-test or pair t-test. And if the quantitative data is two group, unpaired, three or more group, ANOVA, which is analysis of variance, ANOVA. Now here, what is the outcome we are comparing? We are saying that two group are checked for their weight based weight. We are not measuring whether mother has received food or not. This is the two group. One group who received supplement food, one group who did not. This is two group. But we are measuring the weight of the children. We are not measuring who got how much food. Because getting or not getting food is categorical data. That is category. But we are not measuring them. What is the outcome data here? Outcome data is weight. Weight of child. And can we measure the weight? Of course we can measure the weight. So weight is a quantitative data. Weight is not a qualitative data. And can we measure the weight of the child before delivery and after delivery? No, we can only estimate it by ultrasound. But we can measure weight only after delivery. So pre-post match word, these two words pre-post and match, these are not given in the question. Paired t-test is ruled out. Data is weight, which is quantitative. So chi-square is also ruled out. Paired t-test is also ruled out. And there are two groups of mother. So answer will be student t-test. Okay. Now, what is the last option? Fisher exact test. Fisher exact test is same as chi-square test. Only difference is we apply chi-square when sample size more than 30. So if sample size less than 30, or if in the table one table have 2 or 3 variable, less than 5 value, then we apply Fisher exact test. So Fisher exact test is applied when sample size is less than 30 or any one table have less than 5 value, like any table has 3, 9, 10 or 11. So one table has less than 3 value. In that case, we can apply Fisher exact test. But in none of the question they give sample size. So usually Fisher exact is just kept as an option. Answer will be chi-square in all the question. They don't give sample size. So you will take chi-square in all those questions. Okay. So I hope you will remember these 3 simple steps. What are those? Data is given in percentage proportion. Qualitative data, chi-square. Data is quantitative measurable. Before after matched, pair t-test. 2 group unpaired, 3 group ANOVA. 4 group also ANOVA. So with this you can solve 99% question. In 1% time they ask which of the following is a non-parametric test. So out of these 4 tests, pair t-test, unpaired t-test and ANOVA, all the tests which we are using for quantitative data, these are parametric. And apart from these, all tests are non-parametric. In some special cases, chi-square can also become parametric, but mostly these 3 are parametric, rest all are non-parametric. Like Friedman test, Kruskal-Wallis test, Wilcoxon-Rank sum test, sign test, Mann-Whitney-U test, McNemar test. There are multiple tests which are non-parametric. Very simple. If you remember the 3 parametric, you can tell all other are non-parametric. So they have asked which of the following is non-parametric. Pair t-test, Friedman test, unpaired t-test, ANOVA. Of course, Friedman test is non-parametric. Okay, we apply non-parametric test for skewed data and we apply parametric test for normally distributed quantitative data mostly. Okay, chalo. Now, very good. A and D both are non-parametric. Correct, Dr. Deves Pagare, you are right. A chi-square is non-parametric, and Neha, you are also right. A and D both are non-parametric. Very good. Chalo. Now, yes, Sunil ji, nice to see you. Come here. In a survey of sleep apnea, score among 10 people, the highest sample of 58 was entered by mistake as 85. Now, how it will affect the result? So, in place of 58, we are writing 85. So, that means one value increased. From 58, it increased to 85. And this is the characteristic of mean, that mean get deviated towards bigger number. If there is any big number, mean will be towards it. So that means mean will be increased. But this is the characteristic of median, that median is not affected by bigger number. So median will remain same, mean will get increased. So how they will ask the question from this part? In other way they can ask, they will give BP of 5 patient is 122 systolic BP, 122, 124, 126, 128 and 188. They will ask, in this case, which is best to use? Is it mean which is best or is it median which is best? Which is best here? Mean or median? What will be your answer? Please do reply. Which one will be best in this type of data? Mean or median? Very good, Dr. Reformer, Sai, Ganesh and Atharva. All of you are right. Median will be best because here we are using one big number. So mean will get deviated but median will be in the center. So here median is best. Next question. There has been gradual increase in number of non-communicable disease as compared to previous year. What is this trend? So if there is gradual increase, constant increase, that is secular trend. This question has been asked in INICT last time. What is the example of secular trend? Example of secular trend is cardiovascular disease, hypertension, diabetes, because all of these disease, you know that the number of these cases of hypertension, diabetes and cardiovascular disease, with year all the cases are increasing. So that means they all are following secular trend, and of course secular trend is something which is here represented by line diagram. Very commonly asked area of question. Example of secular trend, how it is represented by line diagram, and it is, there should be a constant increase over a long period of time. Okay, that is secular trend. Now I want to quickly revise the question of recent MCI exam, because I have seen for last 4 years 1 or 2 question in NEET directly come from recent MCI. So let's revise it quickly. Washing hand will be primary level of prevention. Many people are dying with cancer, so Government of India put an act to prevent tobacco. So the risk of dying is there and government is protecting it. Answer will be primary. Primary and specific, if both are given in option, we will always tick specific. Okay. Similarly, they have asked this question that there is a cleaning of regular cleaning of filariasis foot. So regular cleaning of filariasis foot will be under which example? That will be tertiary level, but tertiary level was not in the option. So tertiary level is also known as disability prevention. So we can call it, put it under disability prevention, because tertiary level is something which make the person self-dependent. So we are trying to clean the wound to make the person self-dependent. For example, if I ask the refractive error glasses which we use, that refractive error glasses is secondary or tertiary? Answer will be tertiary, because refractive error glasses make us self-dependent. Okay, it does not treat the illness. We will answer secondary whenever we are talking about any screening test or treatment. Screening test or treatment come under secondary, rehabilitation come under tertiary. So that means if we are talking about LASIK surgery, that will be secondary. Now let me ask one last question here. A son took his hemiparesis father for checkup. Which level of prevention? Hemiparesis father for checkup. Which level of prevention? Secondary or tertiary? Answer is, you will have to say what is the answer. Let me put one more question here. Question next. Son took his hemiparesis father for physiotherapy. Okay, I hope you understand. Remember, all screening tests are secondary. And when the son is taking his father for checkup, they will check the BP, they will see whether second attack of hemiparesis will come or not. So checkup means they are talking about secondary. But when we talk about physiotherapy, physiotherapy will make the patient self-dependent. So that will be tertiary. Okay. Thank you so much for replying. Very good. Physiotherapy tertiary, checkup secondary. Always remember, self-dependency is tertiary, treatment and screening is secondary. Okay. Chalo. Now, ground glass appearance on chest X-ray is seen in silicosis, which is most common pneumoconiosis. Most common respiratory occupational disease is silicosis. 2 points which I want to revise from here. What is the causative organism of bagasosis? Why does bagasosis occur? So bagasosis do not only occur in sugarcane mill worker. Along with sugarcane mill worker, it also occur in cardboard factory worker. And in bagasosis, the causative organism is thermoactinomycetes fungus. Okay, if they ask the causative organism of farmer lung, then you have to answer Micropolyspora faini. Micropolyspora faini. This is a heat-loving thermophilic fungus which grow on wet crop. When farmer is putting the crop in the house for storage, then this wet crop grows and cause farmer lung. Okay? Chalo. Minimum per capita space for each children in school health program is 10 square feet. 3 new information about school health program which they can ask. First, they are recruiting 1 male and 1 female teacher from every school. Why? Are they willing to do couple dance? No. They are taking them as health and wellness ambassador. And they will take 1 boy and 1 girl also from the class. What is the purpose of that? They will be health and wellness messenger. So health and wellness ambassador will be teacher, health and wellness messenger will be boy and girl who will teach the students and motivate them for yoga and meditation. That is the main purpose. Another thing is there. Now, which day will be celebrated as Health and Wellness Day? Tuesday will be Health and Wellness Day. Okay, Health and Wellness Day. Now, remember, teacher screen student for refractive error, and if it is less than 6/9, he refer them to higher center. And remember that school health program have minus desk, and in school health program, we are screening children for refractive error. So school health program come under Vision Center of PHC. So it is Vision Center of PHC which look over school health program. Okay. Chalo. Now next question. A child presented with white patches on anterior incisor. If they said white patches, that is dental fluorosis. Remember, white patches, dental fluorosis. And to remove excess fluorine, we do Nalgonda technique where we add lime, then alum, then bleaching powder. 3 things we add to remove extra fluorine. Concentration of fluorine is 0.5 to 0.8, which has been asked in one of the exam. So these were the questions which we had to discuss from the expected question part, which can come in the exam. They have also asked the gross national product which India is investing on health sector. So you have to answer it around 2.5%. It is the expected GNP which India is expecting to be spending on health sector. Okay. Now, do you have any question which they want to ask from any part of biostat? Feel free to ask it. I will like to answer it. I will more than enjoy it to answer it. Ask any your doubt or any topic which you feel is important to be discussed. I will discuss it here with you. Okay. Very good. Anis want to know what is propaganda. Propaganda means we are trying to influence people by telling them something which will affect their thought process and which may affect their behavior and all. Okay. For example, let's say this what can be the propaganda? Propaganda is, I hope you know, propaganda they use commonly in news about political parties, that they are trying to influence people behavior by telling something which is not so important for them, but they will make it as important. Okay, like if I will take some example, it will become political and all. Okay, so I'm trying to avoid being political here because right now we should focus on exam mostly. But let's say if any political party is saying that there will be free ticket for females in buses. So it can be a propaganda which will affect the females, or it can help also female, but it can be taken as one thing. Like you understand now, any thing which is being said to affect people. Yes, I am not trying to be political here, so I am trying to avoid some examples, but you understand what is propaganda, I think. Now, next, Before and after, ordinary Trishuli is asking before and after mein kaun sa test. If before and after is given and data is quantitative, we will apply paired t-test. Okay, paired t-test is same as dependent t-test. Okay, Devika want me to give a quick recap of vaccination. Why not, dear Devika? I will give you definitely a quick recap of all the vaccination topic. I am searching for some empty slides to give you the so let's recap vaccination. Two part we have to recap. One is the live killed vaccine part, because they create a clinical question from here that like let's say they will say it that this child was on nephrotic syndrome. A nephrotic syndrome child was on steroid. Okay, on steroid nephrotic syndrome child. Which vaccine we will not give, or in a child which we will not give, or in pregnancy we will not give. So in all these cases, live vaccine will not be given. And there are total 11 live vaccine, which is very simple to remember. You can remember them by the mnemonic CP pe IJO, come at CP. These 5 are both live and killed. What is C for cholera? P is for polio. P is for plague. I is for influenza. J is for J. So 5 are both live and killed. Then 4 are those vaccine which we already know. Like we all know rotavirus is live. We all know MMR is live. We all know BCG is live. And we all know that yellow fever is a live vaccine, which is not contraindicated in pregnancy. Only one vaccine which can be given. And yellow fever vaccine protect from 10-day to lifelong protection. Then the other 2 is varicella and typhoral. So if you remember just these 2 vaccine, varicella, typhoral, and the mnemonic CP pe IJO, you will remember all the live vaccines together. Okay. And in typhoral is something which we give on 1st, 3rd and 5th day. This is a live vaccine for typhoid. Varicella have this Okka strain. Savila villa. It's time to Africa, Wakka. Remember that same Okka strain, okay, is here for varicella. So do remember varicella, typhoral are live, and you will remember the 11 live vaccine. Now, after this 11 live vaccine, I should have copied. After this 11 live vaccine, there is 7 killed vaccines which are there. So what are those 7 killed vaccine? Very simple. 5 are CP pe IJO, cholera, plague, influenza, polio and J. And then there is rabies and hepatitis A. So if you just remember rabies and hepatitis A, you will remember all the 7 killed vaccine. 5 are CP pe IJO, rabies, hepatitis A. Next question. Next category is of the protein vaccine. Protein vaccine is Novavax for this spike protein subunit of coronavirus. Then there is pertussis and there is anthrax. All are protein vaccine. Then they can ask about toxoid. In one of the INICT they have asked about toxoid. That is diphtheria and tetanus. And nowadays in pregnancy and at 10-16 year we are giving diphtheria, tetanus. Then if they ask recombinant vaccine is something which is hepatitis B. They have asked in one of the NEET exam, in hepatitis B we are using DNA, but which part of hepatitis B virus we will use? Is it HBCAG, HBsAg, HBeAg? Which will we use? Answer is HBsAg. This we use. Now, cell wall vaccine will be useful only for this bacteria, because they have the cell wall. We call it polysaccharide also. And under cell wall or polysaccharide vaccine, one is pneumococcal. Very commonly asked question is, in old age, which vaccine you will give? In post splenectomy patient, which vaccine you will give? In immunocompromised HIV patient, which vaccine we must give? Pneumococcal, because pneumococcal vaccine will protect from pneumonia, which is the cause of death in all these patients mostly. So pneumococcal we always give in them. Second, they say is about meningococcal vaccine. There is one very important thing you have to remember is the strain of meningococcal vaccine. It is ACY W135. So remember, B subunit is not present in meningococcal vaccine. Okay. Then the last is VI polysaccharide, which we use for typhoid. So this is the classification of vaccines which they use in twisted clinical question also. Next, in vaccine, even if you forget everything, please do not forget about this open vial policy. This is something which they ask again and again, the open vial policy. Okay. What is this open vial policy? We all know there are some vaccines which we can use even after 4 weeks of opening the vial. So they ask which of these follow open vial, which of the following do not follow it. Very simple. If you just remember the 4 name: hepatitis A, PCV, all tetanus vaccine, and all polio vaccine. 4 name. These 4 name, they follow open vial policy for sure. Because under tetanus, we all know we can have all those DT, TT, DPT, pentavalent. And under polio, we have IPV and OPV. Okay. So they have, these vaccines follow open vial. Can you remember the 4 name? Yes, you can. Say it with me. Hepatitis B, hepatitis B, PCV, all tetanus, all polio. Hepatitis B, OPV, PCV, all tetanus, all polio, they all follow open vial policy. We can use them even after 4 weeks of opening. Next part, very important, is they can ask you that what is the route of this vaccine? Like in last NEET, they asked the route of JE. So which vaccine is given by nasal drop? There is a new vaccine from Bharat Biotech which can be given by nasal drop also. Can you tell me the name of that new vaccine for corona developed by Covaxin group Bharat Biotech which can be given by nasal drop? Can you give me the name? Nasal drop is also influenza live vaccine. They can ask this question. Then nasal drop is also Zydus Cadila DNA COVID vaccine. These are all by nasal drop. What is the name of that vaccine developed by Bharat Biotech in India to be given by nasal drop? Second, JE and MMR both are given by subcutaneous route and both are 0.5 ml being given. JE and MMR both. Okay, JE and MMR both are subcutaneous 0.5 ml. Okay. Yes, Incovac, correct, Hima Bindu KC, you are right. Covaxin brother Incovac is given as nasal drop for corona. Then if they ask about intradermal route, of course there is 2 FIPV and BCG. What is the dose of BCG we give? Answer is 0.05 ml only till 1 month. After 1 month, we can give 0.1 ml. FIPV we give 0.1 ml. What is the strain of IPV, OPV? Which one is SAP, which one is Sabin? I used to get confused in it. So I used to remember IPV is killed and it is shock. So I used to think it is killed due to shock. Shock laga mar gaya. Killed due to shock. And OPV is live. This is Sabin. Okay, so in one of the class there was one Dr. Pragya, he gave me this example that, sir, we can remember OPV is live by live-in, live in, Sabin, live in. And she herself was in live-in relationship. So she gave that example. This idea came to her mind. Okay. Anyway, you can remember it very easily. Now, the other part they can ask is the vaccination schedule which is there in India. What is the schedule, immunization schedule? Which is also very easy to remember. You just have to keep doing 3, 5, 3, 5, 3, 5. Okay, like we start with birth, where we give 3 vaccine. I hope you all know BCG, OPV, Hep B. And for these 3 vaccine, ASA don't get paid. For all other vaccine, ASA get paid. I will also tell you the salary of ASA, how to remember that table in JSY, which was the question in NEET exam. We will revise that also. So these 3, ASA don't get paid, and these are given at birth. BCG, OPV, Hep B, you all know. Then at 6 week, we give 5 vaccines, so 3, 5. Then at 10 week, we are giving again 3 vaccine. Okay, then at 14 week, again 5 vaccine. So first you have to remember till 14. Okay, sorry, it is getting cut. I will make it better. 10 week, 3 vaccine. 14 week, 5 vaccine. What are those 5 which we give at 6 week? Very simple. It is OPV, Rota, Penta, first dose of all 3, and then there is FIPV and PCV. FIPV and PCV is given at 6 week and 14 week. So 2 here, and the same 3 will be repeated here, same 3 will be repeated here. So 3 OPV, Rota, Penta you will remember, FIPV, PCV at 6 and 14 directly. But in the recent change in the guideline, there is one change only, that FIPV they have introduced at 10 week also. So this is one recent thing they have done, FIPV at 6, 10, 14. And PCV is given here, FIPV is also given here. So can you remember till 14? I hope it is simple to remember. OPV, Rota, Penta, same 3 repeated at 6, 10, 14. FIPV, PCV at 6 and 14. And at 10 they have introduced FIPV. So it was 3, but now it is 3 plus 1. Now, let's read after that. At 9 month, we give, because there was 5 here, so it should be 3. But again, there is one disturbing element here, that is the PCV booster. Apart from PCV booster, we give the 3 vaccines which are JE, MR or MMR, and vitamin A. Vitamin A is given 1 lakh up to 1 year also, and up to 8 kg. They are creating this clinical question nowadays, that a child came at 1.5 years with 7 kg weight. How much vitamin A you will give? So if the weight is less than 8 kg, we give only 1 lakh, not 2 lakh. Okay. Next, at 16 to 24 month, how much we have given here? 3. So now we will give 5. What are the 5? Very simple. JE, MR and vitamin A is repeated same 3. Along with that, we give vitamin A. Vitamin A was there in the 3. JE, MR and vitamin A is repeated same thing. Along with that, we give the booster of OPV and DPT. So total 5 vaccine at 1625. At 5 year, we will give 3 vaccine. Which 3? Simple. OPV, DPT 2 plus vitamin A. So in between this time, we give vitamin A every 6 months. So total dose of vitamin A that we give is 17 lakh, and for that we have 9 visit which we do. So it's not difficult to revise this vaccination schedule. It is 3, 5, 3, 5, 3, 5. We start with 3 at birth. We 2 and our 1 child like that, 3, and at 5 year also it is 3. Finally, at 10 and 16 year, we give DT, and there is also 2 DT at 4 week gap in pregnancy that we give. Okay. So, but we give this 2 DT only if last pregnancy was more than 3 years back and she had not taken 2 DT in last 3 years. Did you understand this point? 2 DT at 4 week gap in pregnancy if 2 DT not taken in 3 years. Like, let's say this was the question in recent MCI exam. Let me write it properly in one separate page. No matter how you start, just finish like Dhoni. Wow, very good. So remember, what I am trying to say is that 2 dt is given if in last 3 year 2 dt not taken. If mother had taken 2 dt in last 3 year, then only one booster dt is given. If mother took 2 dt in last 3 year, then only one booster dt will be given. Okay, you understand now? Suppose I am pregnant, you can see that, and I came to you and you asked, when were you pregnant last time? I said I was pregnant last year only. क्या करूं डॉक्टर साहब, मेरा मुंह खसम छोड़ता ही नहीं है ना, चढ़ा ही रहता है ना. He is like, so if I was pregnant last year only, I said, how much dt you will give me this time? This time you will give me only, and I suppose I told that I took 2 dt last pregnancy, then you will give me only 1. But if I said I was pregnant 4 year back, है ना, मेरा मुंह खसम कुछ करता ही नहीं है ना, 4 year back I was pregnant and all, then you can give me 2, because in last 3 year I have not taken 2 dt. Okay, I hope this is not so confusing, but do remember it. Now the last thing, and this vaccination topic is very good that you asked, because pedia, micro, PSM, everywhere their vaccination is there, so it is very commonly asked area of question. Do remember the 3 diluent which we use. They can ask BCG, MMR, JE are the 3. BCG diluent is normal saline, MMR diluent is sterile water, and JE diluent is phosphate buffer solution. So now how will you remember it? Very simple. When a child is born, at birth we give BCG, so at birth we use the diluent normal saline. जैसे ही बच्चा पैदा होता है, हम उसकी जिंदगी थोड़ी नमकीन बनाने की कोशिश करते हैं. We try to make the life of child a bit salty as soon as he is born, so we give normal saline at birth. Then we can remember M for mother. And mother love is like sterile water. No matter how much your mother is angry with you, just press her leg for 10 minutes. She will melt like ice cream, and she will forgive you. And this is one request which I really want to do with all of you, that whenever, like in once in a blue moon, in 15-20 day, or if you are living together with your mother, you are blessed enough, then you should try to press the leg of the mother, and it will give you like blessing in unimaginable way. Okay, and for your exams also, like you can take the blessing for the present day and you can work better. Okay, so mother love, sterile water, MMR, sterile water. Now in JE, the name itself has Japan encephalitis, so JE have phosphate buffer solution as diluent. Japan, J and P both are there. JE phosphate buffer, MMR sterile water. As soon as the child is born, we give normal saline. Very good. Now Stalin Chandra Bose has a question that if one vaccine of TT for any reason given within 3 years, then is booster necessary? One vaccine of TT do not matter. We need to give 2 DT in last 3 years. If 1 DT is given, we don't count it. If 2 DT is given, then we count it. Okay. So Stalin Chandra Bose question is, if one vaccine of TT for any reason is given within 3 years, then is booster necessary? Answer is, if 1 DT is given in last 3 years, then we give both the 2 doses of DT. We don't just give 1 booster, we give all the 2 doses. Okay. And if they have taken 2 DT in last 3 years, then we give 1 booster. Chalo. Now, Ujjwala Gangwal Gangwal is asking me to differentiate between coefficient of regression, determination and variance. Please. Okay, why not, dear? You need not to say please. Your wish is my command. Okay. Let me find some easy empty. I am using the PPT of my medicine friend, sir. And hopefully he will not object to it and all. So, but he has a good saying. This is your last 10 day of time, okay, before your exam. And in this 10 day, usually we are very anxious and all, and we do not focus on revision well. And this 10 day is very crucial. If you are calm and moving with good speed, you can really score very well. So before going to next topic, let me just discuss this 2 point, that how we can make it sure that we are we will do well in the exam. How we can do that, how we can ensure it that our this last 10 days is utilized well. For that, what we can do? This is one question. So I have just 3 advice for that. One is that if we are preparing, let's say, with this mindset that this exam is the most important thing of the life and death situation, then our anxiety will be more. But if you just remember this point, that in exams, our approach and our relaxation will help us in scoring 30% more. Then the first step for that is, you should not take exam as life and death thing, because it is not life and death actually. After this March exam, there is also an INICT exam which you can give and score well. And in this March exam, if you are relaxed in the exam, your score will be better. So you have to try to relax. How can you relax? Because this thought of failing comes again and again in mind, and that disturbs. So the way to get rid of those thoughts is, replace your negative thoughts with positive imagination. For example, you can imagine yourself wearing apron and walking in the medical college of your dream. You can imagine yourself the party which you will do after the exam and in your JR ship. You can imagine yourself treating patient, helping needy people, and getting true happiness by helping them during your PG and all. So when you will dream about your medical college, your dream branch while preparation, then you will enjoy the preparation, and you can focus on the present day work. So first thing we have to do is, we have to dream things positively, and dreaming positively has a power in it. It will relax you, it will make things interesting. Second step which you can do is, in this last 10 day, focus on previous year question, because if suppose you are unable to revise all the theories, then just by doing previous year question, you will revise all the important areas from which questions are coming. So this previous year question is a known fact that 90 to 95% question is from previous year. So if previous year topic, if not they are directly coming from the question, they are coming from the topic. So let's say if you are not able to revise some theory, it's okay. By doing previous year question, you will revise the important topics of all the subject. So this is the second thing you should do. The third thing which you should do is, on every day, whatever is the exam time, during exam time, try to solve one previous year question paper, or try to do objective question in that time when you have to give exam. Last time is coming, so you have to make it sure that you are waking up and sleeping at right time. And many students, they come and they discuss that, sir, we have disturbance in sleeping in this time and all. All these things are fake and wrong. Your disturbance in sleep is coming mainly due to the phone which you are taking in bed. So I have one request which will really help you a lot is that stop using phone after 8 p.m. from this day till your exam. This you can do. Till 7:38, talk with your parents, family, and stop using phone. Previous year question you can do from book or app. You can make the phone in aeroplane mode, and or you can take some book and you can revise things from there, or from your notes revision you can do after 8 p.m. But stop using phone, mobile phone or iPad or laptop after 8 p.m. That will make it sure that you are sleeping on time. Only then you can follow the schedule on the real day. This will make your sleep cycle better. So if you are doing previous year question in the same time when you have to give the exam, it will mentally prepare you for the real exam, and the anxiety during the real exam will be less. So I just think that these 3-4 steps will really help you. First step is, don't take exam as life and death. Be easy, because you can earn crores of rupees even by taking PSM, Patho, Pharma and all. There's no thing that this is life and death. When you are relaxed in the exam, you perform much better. So you should relax. You should, if you believe in nature or mother, at least take the blessing of mother nature or your mother and move ahead with a relaxed mode. On the exam day, you will perform well. Second, do focus on previous year topic. If you are not revising all the theory, it's okay, but revise at least 5 years of INICT and 5 years of NEET topics should be in your command and grip. In this last 10 day, I will say, go for the recent 3-year paper must, and if you have done it already, 5 years of INICT and NEET you must do, and revise it again and again. Third thing, during exam time you can get nervous, so in this period if you practice objective question in 10-10 block, this 10-10 block practicing is useful, because in the first 10 block, if you have got, let's say, 5 marks out of 10, now in the next 10 block you want to increase it to 6. So you will stop, you will bring the thing from your memory and you will recall before answering. You will not guess. So the same exam is also testing your recalling ability. The same practice will turn out in real exam also, and you will be able to recall even under pressure. So practice recall every day during the exam time. Whatever the exam time, practice recall by this 10-10 block question solving. If you do it in 20-20 block, you will not be interested in knowing the answer of the first question. And if you are doing one question answer, then there is no challenge going on and you don't enjoy doing it and you don't recall thing. In one question answer, you just guess and move ahead. So try to answer question in 10-10 pattern so that you can practice recall, and stop using phone after 8. I am very sure if you did this 4 thing in last 10 days, whatever your score is coming right now, it can increase by 10-15% in last 10 days also. Just first relax, and I would request all of you who are preparing well sincerely to keep preparing till INICT May. Because in May INICT, many students are distracted with these exams and they don't continue the preparation, so there are less competition in May. And in May AIMS, it has been found that around 40% question are repeated from previous year. More repeated question come in May AIMS. And that's why people like me selected in May AIMS only, because more repeated question are there. So I really wish that all of you should follow this 3-4 point and do try to take blessings of your mother or whatever you have faith in. That is a good way which will make you feel that yes, you have a blessing, so you can do much better. Okay, chalo. Now it's already some 2-3 hours session being done, but still let me take 10 more minutes in discussing this 3 point which being asked by the student. Coefficient of correlation, which is represented by R. Coefficient of determination, which is represented by R square. and coefficient of regression, which can be represented by B or M because R is already taken. And after this, I will give you all the 3-4 questions that has come from this topic again and again. So coefficient of correlation R, it ranges between -1 to +1. So if they gave that value of R is equal to 1.2, it means this is wrong data, and it cannot be more than 1. And what does R tell? What does coefficient of correlation tell? It tells strength of association between two variables. Okay, this tells about strength of association between two variables. Okay, so in one of the exam of AIMS, they gave this plot with dots going like this in forward and then going like this in backward. And they ask that in this question, what is the correlation coefficient? Answer will be correlation coefficient is absent, R is 0. Because in one part it is positive correlation, plus 0.9. In one part it is negative correlation, minus 0.9. So finally it will become 0. So correlation is telling us how strongly two things are related. If you do R square, determination will come, and determination tells us percentage variation in one variable on changing other variable. Percentage variation in one variable on changing other variable. Let's say after the class, when you met your room partner or your friend, and you went to the friend room to relax and all, you found that your friend is ready with a joint in his hand, and you are seeing that your friend is smoking too much joint these days. And you all know that this marks in the exam is something which is inversely related to the number of joint per day. If he is smoking 6-7 joint per day, and then definitely his marks is going to decrease. So you want to help your friend. You are willing to decrease the number of joint which your friend is smoking. How can you help? Sorry. You can explain it to your friend that, see, there is a strong negative correlation of -0.8 between smoking joint and marks. So it is decreasing your marks, stop it. What your room partner will do? He will put one puff on your face and will say that you are not at the same level. Take 2 puff and come to my same level, then we will talk. He will not understand this logic. So then you can do the R square, coefficient of determination, and minus sign will go away on square. It will come 0.64 or 64%. So then you can explain it to your friend that, see, my dear friend, if you decreased your joint, then your marks can increase by 64%. So you are telling about percentage variation in marks on changing joint, that is on decreasing joint, percentage variation of one variable on changing other. That is told by R square. Now, regression is represented by this formula, y is equal to mx plus c. So let's say this is the marks, this is the marks and this is the joint per day. Of course, there is a negative association. In this negative association, this slope which is formed, this angle is x, this angle m which I have written, this is the coefficient of regression, and this is the constant c. This part is x, this part is y. So the use of regression is when you said to your room partner that your marks will decrease by 64%. Suppose your room partner said, hey, don't talk in percentage. Tell me exactly, will I be able to pass NEET or not if I decrease joint from 6 to 1? So if he want to tell the exact variation in one variable on changing other, can only be told by coefficient of regression. Because in coefficient of regression, there is a mathematical formula. So they have asked this question in previous year, that if one variable is given, other variable can be detected by which of the following? Answer is coefficient of regression. If one is given, other can be found by regression, because there is a mathematical formula. So you can tell your friend exactly that if you decrease from 6 joint to 1 joint per day, your marks will increase from 30% to 70%. Exact variation you can tell 6 to 1, 30 to 70 with the help of regression. So do remember this 3 point: strength of association, correlation, percentage variation, determination, exact variation, regression. Okay, so let's do the question which came from this topic. In one of the recent AIMS exam, they gave 4 plots of different color, and they said that each plot, each study, each 4 study have a correlation coefficient of R. Each study have correlation coefficient equal to 0.6. So what is the final total R? है ना? Each study R is 0.6. So what is the final R? So we calculate this R based on the distance from imaginary central line. In all the study, the dots are equally away from central line. So in all the study, the R is same, and therefore the final R will also be the same, 0.6. If each study have correlation coefficient 0.6, final will be also the same. Second question they gave already is, they gave 2 plot, one plot where dot were more far apart, one plot where dots are to the point, central. They ask which has greater correlation coefficient. Is it A which has greater correlation coefficient, or is it B? So as I was discussing, correlation coefficient has nothing to do with the angle which is made. It has to deal with the distance of dot from the central line. And if the dots are far apart, it means data is wide dispersed, and this quality of data is not having high correlation. So here if the correlation is 0.6, in B the correlation will be 0.9. B have a stronger correlation coefficient than A. The dots close, more correlation coefficient. If I gave an imaginary plot with all the dots on the central line, then R will be perfect 1, much bigger. Okay, so 2 questions from correlation coefficient. Now let's do a question from regression. In regression, in one of the exam they gave this question. They gave these dots like this, like a snake, and they have also drawn an imaginary line going like this. They ask which regression equation correct. Option A is equal to y is equal to minus x plus c, B y is equal to plus 2x plus c, C 10y is equal to minus 4x plus 10c, or D y is equal to x plus c. Which equation is correct? So here this is y, this is x, and this angle is 45 degree, and tan 45 degree is equal to 1, and this angle is, this coefficient of regression is the angle. Angle M is tan 45 degree, and that is 1. And the original formula of regression is y is equal to mx plus c. So what you can write in front of M? In place of M, we can write 1, only 1. So here it is minus 1, it is wrong. Here it is plus 2, it is also wrong. Here it is minus 4, that is also wrong. In only equation D, y is equal to x plus c is there. Here only M value is 1, 1x plus c. So only D is correct. Now suppose they would have given a question with this type of plot, negative slope. Then the formula is equal to y is equal to minus x plus c, because here the angle will be 135 degree and tan 135 degree will be minus 1. Okay, so if they give this plot, this equation will be correct, minus x plus c. If they gave positive slot, this equation will be correct, x plus c. Okay, so with this we have not only understood this concept but discuss the question also from this topic. Very good, dear Dhana Sai Teja. You are right, my bro Sai Teja. Very good. So thank you so much for this session, and I really enjoyed this session. I hope you also have revised it well and learned some new thing also maybe in the session. And I hope in this next 10 year you will only focus on present day, whether I have done the work of my day well or not. If you will focus on the present day and you did well on this 10 day, your exam will be good. Okay, don't use phone after 8 p.m. and try to do previous year question as many as possible in this 10 day, and don't run behind recent fact, recent thing in this 10 day, because recent question are only 1%. 98% question are from previous year topics. So if you have command over previous year topic and previous year question, that is the area which will give you good rank and good score. Okay, focus only on the things which you have already read, revise only the things which you have read, revise that only, and focus on previous year question. My blessings and best wishes are with all of you. Keep rocking, keep enjoying your life, whatever the situation is. We will meet again in our next session. Till then, hasta la vista, das vidania. Bye bye. Love you, my dear friends. Das ka dhanya. Bye bye. Good night. Sweet dream. Bye bye. Bye bye. Thank you so much. Thank you, dear Stalin, Pooja, Atharva, Kishore, Hima, all the friends who are in the group and who are listening now also. Thank you for giving your precious time. Keep rocking. Bye bye. Thank you.